Hi, welcome to the Beauty Authority. I'm Tatiana Bito, Director of Aesthetic Content. And today's Beauty Authority episode is a little different because we're not just talking about a cosmetic procedure, we're talking about a procedure that ended up being a life-saving treatment. And today I have with me Janine. She's a patient of facial plastic surgeon Dr. Kimberly Lee. Hi, Janine.
Hi, how are you?
Good. So tell me a little bit about your procedure you were going in for originally and what ended up happening during your consultation with Dr. Lee.
I was originally going in for a lower neck and facelift. I hit that 50-year-old point. And so we had discussed that multitude of times. I had already done every possible thing before getting a facelift.
What kinds of things had you done?
Well, in my mid 50s, I started noticing like my skin and my aging. So I thought, okay, Botox, fillers, some laser, but I do some like action film for streaming, and I saw myself on film and was like, okay, it's kind of time to refresh. I didn't want the full massive pullback, but I definitely wanted to look for myself better than I felt that I looked on screen. And so I thought I've done everything else. It's time to, seek out a professional plastic surgeon, which is why after much research, I ended up with Dr. Lee because she only does from the neck up. So I felt really
Yeah.
comfortable with that.
And you came to Dr. Lee and you mentioned that you had I want to make sure I get it right, a fibroid tumor that was pre-diagnosed before you went to see her, right?
Yes, I did. So I have a history of fibroid tumors. I've had two removed. And so I've had before Dr. Lee seen 3 to 4 actually doctors over a 4-year time period. And they all said, I have this lump sticking out of my neck. It's like a little end of a thumb. I see it. You see it. What do you think about it? Can we do ultrascan, biopsy? Like, let's have a look. If it's fine, I'll leave it. I don't want the scar. If it's not, like, let's move forward. And every single one of those doctors, oh, you have a history of fibroid. It's probably a fibroid. I had another doctor do imaging and ultrasounding of it. It looks like a fibroid. It feels like a fibroid. So, of course, I'm just going to call it what they're telling me. I want it to be a fibroid too. So I went on. I mean, it was there for a good 4 to 5 years.
So
And
when you went to see Dr. Lee, you were saying, if you're going to do this work on my face anyway, take care of this tumor that's been an issue, right? That was the idea.
yes. So the thing is when you go to Dr. Lee's office in Beverly Hills, it's very nice. She has a lot of accolades and awards in her room. And so I was sitting there just waiting, and I'm seeing, like, I'm not kidding, 10, 20, 30 awards for head and neck surgeries, not just plastic, but head and neck cancer. And I thought, oh my gosh, I'm in the perfect place to point this tumor out. This is like the appointment right before my surgery. So we've already done everything else, all my pre-ops, and I'm throwing this out there on the table at the last moment because I'm seeing all these awards. So I asked her, like, this, could you remove this? And she's like, oh, that's easy. That's like, totally do that. It's about a half-hour surgery. This is the added cost. And I was like, that's a no-brainer. Let's get it out. She's a plastic surgeon. She'll give me like the best look that I can get
Yeah.
for that. So
At this point, it's all about aesthetics.
yeah, I just wanted to
Yeah.
tighten
Yeah.
things up.
And she is an amazing surgeon. So what actually ended up happening during your surgery?
Well, we had chosen together with the anesthesiologist that it's best for me to not be in twilight due to the nature of the location of the tumor or fibroid or whatever it may be. And so I agreed, yeah, I don't want to be awake anyway. Just put me to sleep and wake me up. And so she had mentioned she was going to just go in, remove that, and then perform the neck and lower face lift, and easy peasy. Should be like, I think, a 3.5 hour surgery. Well, when I woke up, it was a whole new world. I mean, the moment I opened my eyes, there was somebody standing in front of me that I didn't recognize. So I guess that's kind of like the recovery room nurse or assistant. And when I went to speak back to answer questions, I could tell that the entire side of my face was paralyzed. And they let me know
Wow.
that the nature of my quote unquote fibroid didn't look real good, and that it was the 3.5 hour surgery alone to remove it. That Dr. Lee had decided upon seeing it that she was going to strategically remove it with margins, which I had no idea what that meant, and send it to pathology just to make sure. And mind you, I'm looped, my face is paralyzed. And so I just went home with my sister, just freaking out, like, what do they mean they're having it looked at? What do you mean it took 3.5 hours? So that 24-hour time period before seeing her again the next day, I had a lot of questions. I was filled with a lot of fear, but I wasn't sure yet. And they had told me, your face will, the movement will eventually recover.
That had to be so overwhelming, and here you are, during that time when you should be, like, celebrating your new results and recovering, and now you have this huge worry on your shoulders.
This
Yeah.
unknown. So I saw her the next day, and she personally said to me, I didn't like the way it looked. And in the back of my mind, knowing that she was a head and neck cancer surgeon for 20 years previous to 10 years of
Mhm.
plastic surgery, I'm like, is it cancer? And she's like, it doesn't look good, but we need to wait for the pathology report because
Right.
they're very factual, and she's very comforting. And she did everything that she could do instead of sewing me back up and sending me to see an oncologist and having to go through chemo and all that, right? She literally is an angel. So she said to me, like, here's a little bit of pain medication. You're going to be okay. When we get the pathology report back, we'll go ahead and go from there.
That is so frustrating too, to know that you had been to so many doctors and no one was able to diagnose it or clock it, and we know that we need to find these things early on.
Yes, I completely agree with you. There are two doctors that, you don't forget their face and what they're
Mhm.
saying to you. Like,
Yeah.
it looks fine. You're fine. Here, I'm trusting them with my life,
Mhm.
knowing it's there. And maybe it hadn't evolved into a cancer, or maybe it was so small it hadn't got it into the nerve of my face yet. Like, there's all these things that were reeling in my mind. Am I sick? Am I going to die? Is it cancer? Isn't it cancer? That not knowing. And it was only a short amount of time because Dr. Lee had truly advocated so hard that week to get that report back from me and thereafter.
And so let's talk about that report because you said it took about a week?
Yes, my surgery was Monday and the report came Friday evening, and it only came because Dr. Lee called every day, a handful of times a day. Dr. Lee called me up, and the first thing she said is, Janine, is there anyone there with you? And of course, she said it very kind, but my heart just started pounding. My head is wrapped. I'm trying to celebrate, the surgery, but also fear of this. Dr. Lee proceeded to tell me the findings. I did not understand except for the word carcinoma. I, to this day, have a hard time pronouncing my rare variant head and neck cancer, stage
Wow.
2, in the nerve that she had cut and removed from my neck. She informed me that this is very rare, that I will need a specialist, that I need to go to Cedar Sinai, that she's already reached out to people, colleagues that she has worked with there in the past on my behalf. Dr. Lee just like took my hand and walked me through this process right into like the number 2 oncologist in California's office. We were told, most likely, and researching too much online, that it was in a saliva gland here or maybe here. And so
Right.
gonna have to get a
So it
CT.
could travel
Yes,
to other parts of the body. Yeah.
which is also terrifying at 50 years old, just all these thoughts. And she really comforted me. Like, if we get this now, and we get you in there now, and if we find it somewhere else, they're going to cut it out. You're going to need to have the maximum amount of radiation, which was 7 full weeks. Like, she really just told me, and it was so wonderful coming from an educated doctor instead of hearsay, family, nurses, intelligence online, because you
Right.
can really deep dive and scare yourself to a panic stage.
What did your oncologist say about how your tumor was taken out? Was that truly life-saving, taking it out right then and there?
So when I went to see this oncologist that she had gotten me into, and that night he was flying out on a family vacation. So it to another country. So this was like literally the last day, the last minute, the last. And he said, we need to get you in for a CT scan. With a dye that has like a glucose radioactiveness to it, and it goes to all the cancer cells in your body. And he warned me there could be false positives. So I will read these myself, he was saying. And Dr. Lee had mentioned, yes, we read our own patient scans. We see them with our own eyes. So I needed to wait another week to have this scan done. So in the meantime, I'm going through all these fear-based thoughts of where has it traveled? Is it in my brain, my throat, my
Yeah.
spinal cord, my ear? Where? I get the scan. Dr. Ho reads it. I send it immediately to Dr. Lee. So she's reviewing it. He's reviewing it. Um, he's my now head and neck oncologist. So Dr. Ho reads it and says, you do not have cancer in this saliva gland, nor this saliva gland. Dr. Lee has cut out your entire tumor and healthy margins. You will not need a second surgery.
That's wonderful.
I'm like, literally, she saved my life. I do not have cancer anywhere in my head. She knows what she's doing. This was her
Yeah.
expertise. Plus, I have to see her for the healing of my face, which is healing in an unusual manner now, right? Not the norm
Right.
because of what I had gone through. So
Mhm.
let me know that once I do receive radiation, that generally do not have any form of plastic surgery once that area's been radiated. So I was really fortunate. My face looked amazing. It still looks amazing to
You
me.
do look amazing.
Thank you. I just know that Dr. Lee and everything that she did for me completely saved my life and improved it. And now I am very educated after the fear started to dissipate. I'm very educated on my particular type of cancer and how to keep it at bay. I'm completely undetectable. I mean, Dr. Lee, she's just an angel. And yeah, she saved my life by having plastic surgery with her.
Well, you know what's incredible too is that you were spared this, huge amount of time that you would have been worrying pre having the surgery and maybe having treatments that wouldn't have been as effective as having it taken out right away.
I completely agree with you. If she had done what most surgeons do who are not experts in head and neck cancer, like she is, I believe that I would have been sewn back up, would not have had the plastic surgery, and I would have been sent to have chemotherapy. So I would have
Right.
no hair. Radiation does affect your hair. So mine's not the greatest right now, but is growing. I finished my treatment 1 year ago in July. So,
Congratulations, Janine.
yes,
And you're just such a burst of energy. I'm just so glad that this turned out this way and Dr. Lee was able to literally save your life. Thank plastic surgery.
and Dr. Lee for saving my life. And I
Yes.
feel like before the surgery, I was really nervous about telling people that was going in for it. I mean, I,
Mhm.
I feel like there's this stigma on us, like, don't tell anyone. And I'm thinking, well, we've had our eyes done, or maybe some of us our chest,
Right.
or I don't, people have little things done. And why should we be ashamed of taking care of ourselves? I work out, I eat healthy. I'm a world class athlete. I'm a small business owner. I'm a successful woman. So why not into my 50s want to keep up my appearance with my energy?
Yeah. Listen, I always say it's a form of self-care to, to take care of the things that are bothering you. And in this case, it has been the ultimate form of self-care for you. So thank you so much for sharing your story. You are just a delight, and I wish you continued blessings and good health. Now we're going to talk to Dr. Lee.
Okay. Thank you
Thank
so much for
you.
having me.
Hi, Dr. Lee.
Hi, Tatiana.
It's so nice to see you.
Likewise. Thanks for having me.
So we just talked to Janine, and her story is really incredible. What happened when you went in to perform her neck lift that made you stop and rethink your strategy?
Well, she didn't tell me about this neck mass until right before the surgery. So there was really no time to plan ahead. Usually we get some additional tests to give us a better idea of what we're dealing with. And unfortunately, I did not have that luxury with her case. Um, I opened up the neck and it's a little bit different from a routine neck lift in that I told her up front I would make another incision in one of the creases of her neck to get access. But when I identified the tumor or the mass, it looked very different from what I had originally anticipated from conversations with her. She let me know up front that she had been to other doctors. They said that this was a fibroid. It's nothing to worry about. When I saw this mass, it was stuck down to all of these really important structures in the neck. So we're talking about nerves, blood vessels. When we look at these things intraoperatively or during surgery, usually when things are benign, they look a little different. They're well encapsulated. They have
Mhm.
nice planes. They look like they're not really stuck to any other structures. None of those things happened when I opened her neck. So I already knew that I was dealing with something a little bit more intricate and a little bit more concerning. I think it's really important to recognize when we're dealing with surgery in the head and neck, there's a lot of very important, intricate structures, nerves, blood vessels, things that are different than other parts of the body. And that's why being a head and neck surgeon, the training is so long because we've got to learn all of these critical structures.
Janine did mention your history and your experience, and that she said that's what made her feel comfortable asking you to take it out with, her neck lift operation. What could have happened had she not taken it out?
Well, I think that this had already had signs of invading the nerve. So nerves are like highways. They allow tumor or cancer cells to spread through the body. And so this cancer would have continued to grow, continued to invade surrounding structures, but taken the highways to spread to other parts of the body. And that would be called metastases, where they now go to other parts. And that would have been really truly a life-threatening situation.
Yeah. And she was very fortunate, and I told her it almost took away that period of anxiety before a serious surgery like this because she didn't know that it was cancerous. So she mentioned maybe someone else would have maybe, sewed her up and sent her off to the oncologist. How important was it for her to have the right care after this surgery?
Oh, I mean, it's critical. And I think, as physicians, we want to be advocates for our patients and we should be advocates for our patients. That's why they trust us to go to sleep so that we can do surgery and they're entrusting their lives in us. And so once I had the diagnosis back, I knew it was really important that she get the right care. And sometimes patients don't really know who to go to.
Right.
I'm fortunate as being a head and neck surgeon, I know a lot of other head and neck subspecialists and I have those contacts. And so it was just a matter of making a few phone calls. And of course, the catch 22, the head and neck oncologist was going to go on vacation. So I put in some calls and pulled in some favors. And I said, you really need to see this person. I really need you to add her on before you go away. And so she can get the appropriate testing and, there's some workup that needs to be done here so that while you're away, she can get that done. When you come back, it'll be here for you. And so he was generous enough to add her into his schedule. Um, I think as doctors, when other doctors call and advocate for patients, we're much more willing to see those patients and help them. I mean, that's why we're doctors. We go in to help people. And I think that timeline was also really critical in getting the care quickly and getting her to appropriate care.
How important is it for patients to really vet their doctor and kind of, get an idea of what their specialty is and what they really do?
I think that's a great question, actually, because it's not something that most patients necessarily do. In her case, she was going to have an elective aesthetic procedure. And
Right.
so most patients go on Google, they Google and they call a couple people and they go in and get this done. I think what's unique about Janine and her support system is that they really researched this. They looked at credentials, they looked at training, they looked at where you went to medical school and residency and your experience. And I think really when it comes to cosmetic procedures, surgery in the face and neck involves the delicate nerves and blood vessels. So it's really important to choose a surgeon who has both aesthetic expertise, but also the head and neck training means you have somebody who can recognize and safely manage anything else that arises, even something rare like a hidden tumor. A facelift is about aesthetics,
Mhm.
but also happens to be one of the most delicate parts of the body. So when something unexpected, like a tumor appears, you need a surgeon who can recognize it and act immediately. And that expertise can save your life.
It's amazing. I mean, it's such a rare case and story to hear that plastic surgery saved my life, but it's a wonderful story. And Janine is such a great testament. She has such a good attitude, and you really did save her life, Dr. Lee.
Thank you. It's why we become doctors in the first place.
Yeah. Well, thank you so much for coming and sharing this story with New Beauty and your expertise. It's always a pleasure.
Thank you so much for having me. We really appreciate, I think, highlighting stories like these because a lot of times patients don't always realize or think something like this could happen to them. Patient awareness is really important for
Yeah.
instances like these.
Thank you again, Dr. Lee. It's a pleasure talking to you.
Thank you so much, Tatiana.